All right. Hey, guys. Hello and welcome. Good morning to you. Today, we are going to talk about breast cancer out of the perspective of a breast cancer survivor. We included a little presentation to have an overview of the different breast cancer types. This is not exhaustive. This is just a little brief overview so that people who listen or watch this webinar get an idea what we are actually talking about. So today, as a special guest, I have invited Andrea Behrendt. I met her in France at the MedTranslate 2025, and we got a really nice connection very fast. We were like, hey, I know you for many years now, right? And then she got, she told me her story of her breast cancer and journey. And then we also ended up working together on the German and Spanish Latin American version of How to Speak Cancer. So Andrea, you're also in the team with Andrea. Andrea and Andrea now. I realize. Oh, yeah, exactly. All right. So thank you, Andrea, for being here and for having this MedTalk with me today. I would just say we start with a short introduction into the topic. Breast cancer has many forms. There's not only just one form and one cancer you can treat. It's more like different forms. Some are more common, some are less common. And the doctors usually classify the breast cancer after origin. So if it is in the ducts or in the lobules, if it is invasive or in situ, which we will explain a little later, and what drives the growth of the cancer. Is it hormones? Is it other drivers? Or are there no drivers at all? Is it genetic? So there's a lot of information a doctor has to actually capture before you have a proper diagnose, like before you really know what's going on. So let's check out what we are looking after when we want to get a diagnosis. As I said, you can have tumors in the ducts, which are leading to the nipple. You can have tumors also here in the lobules. Those are the most common. And then you can also have tumors here around those. Or there are some other rare tumors, which we will explain later on. Carcinoma is the term that is usually used, and because like when we hear about breast cancer, we hear about carcinoma, and then that's the reason because most of the breast cancers are those type of breast cancers, like 70 to 80%. When we talk about adenocarcinoma, then we are actually talking about those ones here when they are in the loops. Just need to admit another guest. In situ means that the tumor is only in a tiny space. So that's most of the times it's like a really good prognosis for in situ tumors. Whereas invasive, infiltrating means that the tumor has spread already in other tissue around the original tumor. And then metastatic is the next step when there are cells defined somewhere else in the body, in the bones, very often when we talk about breast cancer. Now, maybe Andrea, you want to take this slide and combine that with your story?
Yes, thank you very much, Katrin. Thank you very much for inviting me today to your MedTalk and for allowing me to be part of your presentation. Yes, so I need to wear my reading glasses because I cannot see a thing. Yes, so my first diagnosis when I had to face breast cancer was DCIS, which is a ductal carcinoma in situ. And this is the earliest form of the disease. And I don't know if you want to explain something about the the slide, how the cancer originated or so?
Well, basically, what is the difference between the invasive one? Like the cancer starts to grow somewhere. And in this case, it starts to grow in the ducts. And then only few cells, like this is also what we call in situ, is just here. Some cells are actually cancerous. And when we talk about invasive, they will break this wall here. And then we call it an invasive cancer. Yeah, and that's the one actually you got diagnosed first, right?
Exactly. The first diagnosis was DCIS. And afterwards, they detected a satellite tumor, and then they changed the first diagnosis into invasive ductal carcinoma, and that is the next slide, I think.
Yeah.
Exactly, because it had built a smaller satellite tumor just connected to the primary tumor.
Yeah, and then that's what I said. That's the most common tumor. 70 to 80% of breast cancers are this sort of tumor. And the good thing is it's quite good treatable. It's got a good prognosis. And then you said you were also in no special type. Would you like to explain that a bit more?
Okay, that is what my report stated, actually. Yes, it was no special type, and all the doctors that I had, the first and second diagnosis, they all told me that it was the easiest type of breast cancer, and one of them even dared to call it a nice guy, which I found pretty annoying because we are speaking of cancer here and not of a friend that I just met somewhere. But yes, it's the most common type of breast cancer, and it's the easiest to treat. Let's call it like that.
Yeah. I mean, that's also probably because it's so common, then the research is quite far already.
Exactly.
Yeah. So here we can see again, this is like the fatty tissue we have in our breasts, and this is the duct. And the invasive duct carcinoma also goes through into the fatty tissue. So it's not just in the ducts anymore. This is what we call invasive. It's a very early stage anyway, still.
Yes.
Invasive lobular carcinoma is more like a risk factor, not really a carcinoma. So it means that here, this is like the normal cancer type. We have a lump. And this ILC is more that those loops are actually thickening. And then if you have that, then doctors know that this needs to be watched, like looked after. And there might be another schedule for mammograms or MRIs, because you see them actually better on MRIs than on typical mammograms where we usually go, depending on which country we live, of course. Then yeah, exactly, that's what I said before. It's more like a risk marker and not an invasive cancer. Yes, we'll take that shortly. Yeah, and now we come to the treatment options and to the different types of cancer sensitivities. So again, Andrea's cancer was ER and PR plus. Would you like to explain us a bit more about that?
Exactly. That means that the tumoral cells, the cancerous cells, feed on estrogen and progesterone, which our body produces, and they need to cut the supply of food, let's say, to the cancer cells. That's why I immediately had to start with Tamoxifen as a hormone therapy, and it's called a hormone therapy, but it's actually an anti-hormone therapy, because it stops the or it hinders the tumor cells to dock on your estrogen and progesterone and feed on that and grow even more.
Yeah. And now you switched your medication, right?
Exactly. Last year in September, I had to switch my medication because Tamoxifen is only indicated as long as you're still having your menstruation, your monthly bleeding. And once you are in the menopause, which was in my case in August 24, 1 year after that, it's considered to be really in the menopause, and then you have to switch to aromatase inhibitors. And in my case, switched to Letrozole. And yeah, we will see what happens now because I have quite some side effects from Letrozole, and I need to speak about it to my gynecologist in my next appointment and to see if we can change the medicine because it's really heavy.
Yeah. Yeah, you said that you're in a lot of pain. We don't want that,
Yes,
right?
exactly.
So, when it comes to the discussion about life quality, right?
Exactly. So one of the side effects of the major side effects of Letrozole is the joint pain. And at the moment, I have joint pain in every joint in my body. So it kind of restricts my quality of life
Yeah.
quite a lot. And yeah, that's what I need to speak to my gynecologist about.
Yeah, wonderful. I hope not wonderful. Thank you for sharing. Sorry. I hope you will find another treatment which has less side effects for you.
Thank you. Yes, I hope so.
Well, then when we talk about treatment options here, we also have the HER2 positive tumors. That means they produce too much of that HER2, and that again is a growth factor, which means if you have too much of it, the tumor will grow fast. Therefore, we have targeted therapy these days. Herceptin is one of those medications that are approved and are working quite well. So you will hear, like when you get into the breast cancer, either as a patient or as a communicator, you will hear all those acronyms or abbreviations a lot. So yeah, digging into this is a good option to stay ahead, and then also to understand the clinical trial communication forms. There's always something about that. Anyway, I'm not taking the wrong path here. We have the triple negative breast cancer too. That means that it doesn't actually respond to any of those other treatments. It's not ER plus, it's not PR plus, and it's not HER2 positive. So it needs a complete different treatment approach, and that is usually chemotherapy these days, and it's still also seen as a very aggressive type of cancer, and it doesn't make a lot. There are not a lot of numbers, and yeah, luckily not a lot of people having that. It's only 15% of the breast cancer patients, and they are also more common in women under 40, so young women, and Black women apparently. So as I said, the challenge is that it doesn't work with the other treatments that are well known, but there is a lot coming. There is a lot of research going on, and some immunotherapies work also already, or are shown to be working for this kind of breast cancer. We have some really rare breast cancer types, which inflammatory breast cancer is one of those. When you have that, then it will show in redness and swelling. That it will be warm, the breast will be warm, and what is very a very great sign for it is that the skin will look like orange peel. So if you have a mastitis when you nurse your kid, we all know that when you have the swollen breasts, but it doesn't look like an orange peel. So when you see that your skin is weirdly shaped and has all those inflammatory signs, you should definitely go see a doctor. It's only 1 to 5% of cases, so it's very rare actually, but it's quite aggressive too. And because of the mastitis, it's often misdiagnosed in the beginning. So yeah, it's very important that one is aware of that form of cancer too. Those are some other very rare cancer types, which I won't discuss too much for now, because this MedTalk is actually about Andrea and her story, and I'm looking forward to hearing more of that. One last thing that is very interesting for me, or important for me to say, is that not every lump, not everything you feel in your breast is a cancer. It's often, very often, cysts or fibrosis. And yeah, it's hard to stay calm, because I just had the situation between Christmas and New Year's that I had some findings in the mammogram, and I freaked out, even though I know a lot, but I still freaked out. And luckily it was just a cyst, but yeah, some of my worst days, really, especially in this time of the year. One thing I still want to mention is the male breast cancer. There are males getting breast cancer, and I would also like to enhance that it's, even though it's just under 1%, but still I read about quite a lot of guys having that. So if your husband or son or whoever you know, friend, mentions a lump in his breast, be aware and send him to the doctor and get it checked. Yeah, these are the sources the resources I used, and some numbers wherever you are in the world when you listen to that. There is everywhere some foundation, some patient organization that will help you with all your questions. All right. Now let's start from the beginning, Andrea. Now that we have the facts on the table, I would love you to tell us more about your very own journey. When did it start? How far in the process are you right now? We heard you are still in the treatment.
Yes, I am still in the treatment. So the diagnosis was in June 23. So a little bit more than 2.5 years ago. So I would say that I'm more or less halfway through my therapy and my period of therapy, which is normally 5 years. And yes, I don't really know exactly when it started. So I've always done a regular self-check on my breast. And at one point at the beginning of 2023, I noticed a small lump. It felt like a very small stone in my breast. And I didn't pay much attention to it at the beginning. It was like, well, okay, there's something there, but I don't know. And during the first couple of weeks or so, I didn't feel it every day or every time that I touched it or so. And that's why at the beginning I didn't really care so much about it. And more or less around the month of April or so, I started feeling it every day, every time that I touched my breast and this specific point. And I had an appointment with my gynecologist planned for end of May of 23. And so I told her, yes, I think I have felt something, a kind of lump in my breast or so. Can you please have a look at it? And she was like, well, okay, yes, let's have a look at it. Quite confident, both of us, that it was nothing. And then she also did an ultrasound. And when she did this ultrasound, her face changed completely. And although she told me, well, I cannot tell from the ultrasound alone if it is cancer or if it is something else, but there's definitely something there that needs to be checked and needs to run further checkups and studies and things. And the problem was that she was going on a holiday 2 days later, And so she said, even if I make a biopsy now from your breast, when the results come in, I won't be here, so I won't be able to tell you right away if it is cancer or not. And so she sent me to a colleague of her, and this colleague did the biopsy and another ultrasound and also a mammogram. And from the mammogram, he could see that there was something there, but he could also he couldn't tell either if it was cancer or not. But when he made the biopsy with this ultrasound, he saw the satellite tumor or something else, and there was also blood circulation around the tumor. And that is an indicator of cancer, of the cells like being very active and so. And yeah, so a week later, I got the results from the biopsy, and it was definitely cancer. So yeah, that was my journey. The diagnosis came on the day that I turned 50 years and a half. So yeah, exactly half a year after the deadline that you have, at least here in Germany, where I live, where you get all your invitations for a mammogram and things like that.
Is it still 50 in Germany?
Yes, it's still 50.
Yeah, interesting, because here in Sweden it's 40, and people are saying it's too late anyway. I mean, as we heard, there are young people getting cancer too, like really young women, and more. So
yes.
Yeah, but you did the mammogram because of your symptoms, or was that a checkup mammogram?
No, the mammogram was at the doctor where my gynecologist sent me to, and it was because of the symptoms. Yes, exactly. Yeah. So this we should have, or I should have gotten an invitation for this mammogram, and every woman around her 50th birthday gets this invitation. And I live in a very rural area, so we don't have really access to all this mammograms and hospital appointments and so on. And what we do get here is we call it a mammamobile, which is a huge truck with all these scan devices and so that comes to a place nearby. And so all the women in the region that are 50 years or older are invited to go to those scans. And I was at the gynecologist a few weeks before my 50th birthday, and she told me, well, okay, you're going to get the invitation in the next few weeks, and please go to the mammogram. And I say, yes, of course, I will take the appointment and do it. And the invitation never came. It came 1.5 years after my diagnosis. And yes, and when I called them to tell them, well, thank you for your invitation, but I think it's a little bit late. Yes. They told me, well, it's because it's such a rural area that this truck only goes there every other year.
Wow.
So you may have slipped from, my birthday is in December, so you may have slipped under the women that were recruited for the appointments. And so it meant that my appointment was due like the next time that the truck came to our area, which is 2 years later.
Wow.
Yes. And also at that time when I got the invitation, I couldn't take the appointment to go to have a mammogram because my last mammogram had been only a few weeks before that. And to avoid the risk of like over radiation from the mammogram and so on, they told me, well, you're not allowed to come to your appointment because you had a mammogram just a few weeks ago.
And where was that mammogram then? That wasn't in the truck, obviously. That was in the clinic?
No, it wasn't the clinic, of course.
Yeah.
It's in the clinic where I had my regular mammograms after the treatment, after the surgery. And those were every 6 months up until last year. So from this year on, it's only once a year. Yeah, so the first 2 years after the treatment are considered the most risky ones, and they have to go very, very often to appointments to have a mammogram or also an ultrasound and so. But now, since I am in the 3rd year after treatment, it's only 1 mammogram a year and 2 ultrasounds a year also.
Before we go to, because your treatment didn't stop with the operation or with
Right.
actually we just talked about the diagnosis. But before we go further, I wanted to ask you, what would you advise every young woman or woman to do to prevent that? Because obviously mammograms, first of all, they don't catch every tumor.
Right.
And then it's very late. So what would you advise?
Exactly. So my advice is always have a self-check of your breasts and start as early as possible. Even if you're way too young to officially get breast cancer, or at least what the statistic says. But the sooner you can start, the better it is. And if you feel something that wasn't there before, that feels strange, abnormal, go and check it. Go to the doctor, ask for an appointment, and don't give up if the doctor says, well, it's probably nothing, or you're way too young to get something, or whatever. Just insist and no, I want a mammogram. I want further checkups to have these under control and to see if it is something or not.
Yeah. I would add know your family history.
Yes, exactly. And in my family, I am the first woman to have breast cancer. So there were no for previous cases of breast cancer or any cancer related to breast cancer as well. So nothing. It came really out of the blue. Mm-hmm.
Well, if that is not the case, if you have several women in your family with either breast or esophageal cancer, I might have pronounced that wrong, but then there is the option to get checked on BRCA1 and 2. So that is something that I would really like to know everyone who is listening to this. If your mother, your aunt, your grandmother, whoever had at a very young age breast cancer, or you have had that similar or many times in your family, look also at your father's side, then you might need to check on the BRCA1 or 2 as well. It's not only for breast cancer or gynecologistic cancers, it's also for other cancers a marker. And as you said, you can't check too much, right? You can
exactly
can't be too careful.
Exactly. And one thing it's also very much on vogue at the moment in social media or so, it's know your normal. So as I said before, the sooner you start, the better. And then you know what is normal to you, how your body tissue feels like and what your breast looks like and so on. And then if you notice anything that is out of your normal, then it's a much better option to go to your doctor as soon as possible and have it checked.
Yeah, absolutely. Completely right.
Mm-hmm.
Okay, so now we've got your diagnosis, and how did it go on? Like you had the biopsy, you had your...
Exactly. So I had the biopsy and I had the appointment to get the diagnosis. And after that, since it was a very easy to treat cancer, as the doctor said, they even allowed me to go on a summer holiday after my diagnosis because we had already booked everything. And we would have had to cancel, of course, our holidays. But they said, no, maybe it is a good idea if you go on a holiday and you get something else in your head, in your mind, and spend a nice couple of days with your family and so. And after my holidays, after we came back from the holidays, I had surgery. And so they removed the lump and they removed also the sentinel lymph node.
Mm-hmm.
And 1 month after the surgery, I was admitted to radiotherapy. And the radiotherapy lasted for, so I got 24 sessions. Sessions are every day for 10 minutes. And so it was 5 weeks in a total radiotherapy, and then it was over.
But you had some quite severe side effects there too, right? I remember
Exactly.
you telling me it's quite heavy. Would you like to talk about it?
Yes, so from the radiotherapy, I had so my skin was severely burned and damaged, and the doctors didn't really pay too much attention to it. They just checked it and said, "Yeah, well, that's normal. That's a normal side effect from radiation." Okay, thank you very much.
Yeah.
My skin was falling out into pieces. It was like after a heavy sunburn that you get. And the thing was that after you have a sunburn, for example, you wouldn't normally go again into the sun.
Yeah.
But in this case, I had to go to radiotherapy every day.
Again and again, yeah.
Again and again. And so
Yeah.
my skin it looked terribly. It was terrible from a feeling, and it burned, it itched, it hurt, everything that you can imagine.
Did you get any support, any stuff? What would you advise to someone who's going through that?
Yeah, insist on the severeness of your symptoms and everything that you feel. And I got some creams to put on my skin, and from one of the nurses, I got the advice to put some cotton, like the cotton that you use to clean your skin, for example, after makeup or so. Put some cotton between your bra and your breast, so that it doesn't the bra doesn't touch your breast so much. And yeah, that was okay. That was a good tip, a good advice. But yeah, I think the skin burn was so severe, so heavy, that nothing helped very much at all. And yes, and after that, a few weeks after that, I got also a quite severe cough, and this was also a side effect or a consequence from the radiotherapy. It's quite rare to get that. At least that's what the oncologists all told me. But I got it, and so I had to have another therapy with cortisone, which was really annoying. But yes, it's
Yeah.
okay. Mm-hmm.
I just want to, so that the people who don't have an idea, when you get radiation therapy and you talk about your burned skin, you're not talking about a little spot like that.
No.
You're talking about.
Yes, it's called a
Describe.
spot brand, and so in my case, it went like from here, from this part of the neck or so, until the
Sternum.
breast to the sternum, yes, and also under my armpit. So all this, I have to show it to the camera, all this area was severely burned, yes.
I remember you telling me that this was the most challenging time for you and the most exhausting time.
Yes.
And then of course your body has to heal, it needs a lot of energy to heal from those burns. And it's not just burned on the outside. That is also something we need to think about. The whole breast inside is just as burned. So there is a big spot that needs to be taken care of from your body. And that's probably, people think, yeah, you're only going 10 minutes to the radiation, but no, it's actually, the thing before and after, yeah.
Exactly. And it's also quite mentally exhausting. It's not only physically exhausting. I was really tired, feeling a lot of fatigue and tiredness and everything. And it's also mentally very challenging. And it really takes a lot of mental energy to go to your appointments every day and to face all the consequences of the treatment. Of course, on the one hand, you feel or you think, well, this is good for my body, this is good for healing, this is good against cancer. I want to get rid of cancer. I don't want to have it again. So I do it. I'll take it. But on the other hand, it's extremely exhausting and draining, and
Yeah. I want to talk about, I mentioned at first that I freaked out once I heard about the result. You seem to be so calm. How did you feel when you got diagnosed, and how do you feel now? And I can imagine it's a journey. It's like, oof.
Absolutely. I also freaked out. I must also say that I was alone at my appointment. So never go alone to your appointment where you're going to get the news if you have cancer or not. That's my advice. Never go alone there. To take someone with you, a friend, your husband, your partner, your mother, whoever. But don't go there alone. And so this doctor that told me, yes, you have cancer. I had the feeling that he didn't even wait until I was properly sitting on the chair. I was just like on my way to the chair to sitting down, and he told me, well, you have cancer. I was like, what? Are you sure? No, it's not me. It's somebody else. It's not me.
Yeah.
And I was shocked. So my first reaction was like, this is not happening to me. This is just a nightmare, a bad dream. I'm going to wake up the next second or so. And yes, I also had this feeling of like a hole opening under my chair, and I was just falling and falling and falling, and there was no way to hold on to anything. And even though, or maybe because I was alone at the appointment, I really had to concentrate on what the doctor was saying.
Yeah.
Like, what is the therapy? What are the next steps? What am I supposed to do? And yeah, so I think the first couple of minutes I was okay. I was just trying to focus on what he was saying. And after the appointment, I went out and I sat on a chair at the doctor's waiting room, whatever, practice. And I started crying. I just completely broke down and started crying. And it's like, this is not happening to me. Why?
Yeah.
That's, of course, I think that's the question that every cancer patient asks. Why? Why me? What did I do to get this? And yeah.
Oh yeah, I can really imagine that. And going alone to such an appointment, yeah. I was lucky that I had my friend with me, and I keep saying also when it comes to how to speak cancer that in the first initial appointment, when you meet the doctor and the doctor tells you the diagnosis, actually there's no more information needed in that moment. You can't digest anything. So either you have someone digesting that for you, or at least listening, taking it in to tell you later on. Exactly. Or as I would love to see that patients get another appointment a few days later where we can then actually go through the information, and I cannot imagine how you can like really digest what the doctor's telling you after getting this diagnosis. And
it's just you accept it, you accept the diagnosis, and you say, okay, well, that's what the doctor says, but there's no way to digesting it.
Yeah. How did it go on your holiday trip? They sent you on a holiday trip, so do you recommend that, or do you say no, it was like completely
probably not. Probably it was just extending my suffering, and I just wanted to get rid of it. And knowing that I had a tumor, cancer inside of me, and that I was carrying with me all the time. No, I must confess that I have no memories from that holiday. I don't know what I did in those 2 weeks. I only know that we were in Corsica. That's the only thing that I know, but I have zero memories. Maybe sometimes if I look again at the photos or so, then, okay, something comes back. Okay, good. But from myself, I have zero memories of that holidays.
Yeah.
And my advice would be, if I had to do it all over again, I would say, I want to have surgery tomorrow.
Yeah.
I want to get rid of it. I want it out of my body. I don't want to have it with me anymore. And so, yeah. I think I would
completely
rather
relate.
cancel my holidays and go to surgery next week or so.
Yeah, that's what I thought when I thought about that. In that moment, you just want to get rid of it. You don't want to go on a holiday and feed your tumor. Is it like, right? You just want to get rid of the cancer. I cannot imagine how anybody could, relax in that situation and using the holidays. So yeah, I completely relate. So now you had the radiation, and after the radiation, you had time to recover.
Yes, more or less, a little bit, I think. But I also stopped working during my treatment. And so there was, first of all, this financial need to generate income again and go back to work as soon as possible. And also, I felt so lonely during treatment that I needed to speak to other people and be amongst people and just speak about something else and not my cancer all the time and my treatment.
Yeah.
And
Did you join any organizations? Did you join any patient organizations?
No, I didn't. And yeah, I think it was basically because we live in such a rural area that we have barely access to all these organizations. Of course, nowadays you can do a lot of things online or so, but no, I didn't try any of those organizations in my case. Yeah.
And did you get another topic that is very important for me is clinical trials? Did you ever get an invitation, or did anybody ever talk to you about a clinical trial as a treatment option? No,
not at all. Not at all.
Interesting.
I think they just thought that, well, okay, this is just an easy to treat cancer type that let's go to the normal treatment and standard treatment, and that's it.
Would you have wished to be invited to a clinical trial, or at least think about it?
Maybe if I had a rare type of cancer, maybe yes. But since it was quite a common type of cancer, I completely trusted in the standard therapy.
Yeah.
And maybe if that didn't work, I would have asked for alternatives, also including clinical trials. And so, yes.
Again, there is something maybe we should mention is that you live on the border to Switzerland in Germany still, but then it's very far to the next clinic, bigger clinic. Yeah.
Yes,
it's
so I had
Germany. So you went to the Swiss clinic.
Exactly. So my surgery was in Germany, in Freiburg in Germany, which was a 2-hour ride one way to the clinic. And I didn't want to have my radiation there because, as I said before, radiation means going there every day for only 10 minutes. And I didn't want to spend at least 4 hours a day minimum in the car and for only 10 minutes radiation. So I looked for alternatives in Switzerland. I also have to mention at this stage that I have a private health insurance in Germany, which allows me to choose my doctors, my specialists, my clinics, wherever it suits me. And they were very, they didn't have anything against me choosing Switzerland as my treatment country. And they understood that this other clinic in Switzerland that I chose was only half an hour from my home. So they said, well, okay, of course, quality of life, and we understand that this 4-hour ride every day is extremely stressful for you and for your body in an already extremely stressful situation.
Yeah.
So they approved of me having my radiation in Switzerland. That was absolutely no problem.
Yeah,
which I'm very grateful for, because that's not the case for most people that I know.
Absolutely, yeah. So you did have some luck in the end, at least. Yeah.
In the end, yes.
Yeah. So you went through radiation in Switzerland. when you were done with the 5 weeks radiation, did you then start your hormone? No, you started your hormone treatment right in the beginning, right?
Yes, I started right at the beginning, one day after my diagnosis. Yes.
And you still took it until your menopause?
Yes. Yes.
All right. Did you have any rehab after all this?
Yes, in Germany, you are entitled to a rehab after cancer treatment, surgery, whatever. So I had a rehab also in Switzerland. And again, my insurance was very supportive in this case.
Cool.
And I had ambulant rehab, and that was very, very good. Normally, the rehabilitations that you have in Germany are stationary. So you go to a place for 3-4 weeks, whatever, and you have your rehabilitation there. But I didn't want to do that. I wanted to start working again as soon as possible. So I combined my re-entry into the job with this rehabilitation, and the rehabilitation was 5 or 6 weeks. I'm not sure.
And what did you do there? What can one expect from a rehab?
A lot of massage, a lot of physiotherapy, lots of sports specifically to like build up muscle and protect my breast tissue that's still there. And I also had to go to lymphatic drainage because I had a lymphatic edema. And yeah, that was also part of all my treatment. Yeah. So basically a lot of massage and sports and physiotherapy.
And did you ever get any oncopsychology, any
Yes.
support?
Yes. During radiation, I had 3 sessions of psycho-oncology. Yeah, and they were really, really helpful. I recommend it to everyone having that treatment to go to see a psychotherapist specialized in oncology, so in cancer patients. And yeah, the first session, I only cried. I could only cry all the time. I couldn't speak. I couldn't say anything. I was just like sitting there and crying. And why me? Why am I going through this?
Yeah.
And then the second one was very good. I was able to speak a lot and to get a lot of advice from my therapist. And so that in the third session, she said, well, I think you're on a very good way of being independent now after treatment. And if you ever need anything, just call us again and come back to us. We're here to help you.
That's wonderful.
Yeah.
Did you have to ask for that, or did you get that in treatment plan?
I got it offered as part of my treatment plan. So as soon as I went to my first appointment in this clinic where I did my radiation, they offered this psycho-oncology service to me, and I accepted it. I said, yes, I'm going to try. Why not? And yes.
Great.
That's very good.
All right. So this is 2.5 years ago. Where are we today?
Exactly.
Describe your situation today.
Yeah, still struggling physically with a lot of side effects and consequences from the treatment. I have a huge scar where they removed the lump and the tumor. I see the scar every day when I shower, when I look in the mirror, and I'm disgusted about my scar. I hate it. Yes. But yeah, all the answers that I get from my doctors regarding my scar as well. Well, you could go to a plastic surgeon and ask for filling with your own fat body or so, and or body fat, and maybe the scar will look better after that. But I think it's still like another procedure, another surgery, and I don't really want to go through it again. And so I'm kind of accepting my scar, or learning how to accept my scar and everything that goes with it and with the treatment and so. And yes, so I must also say that through my insurance, I was included in a after cancer program, and I started in December last year. And so I have a psychotherapist also calling me once a month, and we speak a lot about like all the consequences, everything that came after treatment. And one big issue that we speak about is this acceptance of the consequences of my new body, my new mind, my new me after treatment. And this also includes accepting my scars and my, as I said, my new body after treatment.
Yeah, I hear that quite often. I'm on social media in the breast cancer groups and stuff, and you see that quite often, that once you're over the acute treatment phase, and once you kind of like accepted that you are now, that you survived, you don't fight anymore, then it crushes down, and then you really start to you have to reinvent yourself and to
Exactly. And cancer changes you forever. There are parts of me, of my old me, the old Andrea, that remained in the past and that will never come back. And some of them I don't want them to come back, and some of them I miss sometimes. Sometimes I also miss the life that I used to have before cancer. So I'm trying to get used to my new life after cancer and to accept it and to find nice things in it. And one of the things that I learned from cancer is to be aware. I think I'm much more aware of everything that goes around me. And I try, whenever the day finishes and I go to bed or so, I try to go through the day again and find at least one positive thing on that day. And that positive thing can be tiny little things like, oh, I saw a butterfly in my garden today, for example. Or now the spring flowers are starting to come out of our garden, also out of the earth. And sometimes it's really tiny little things, but try to find at least one positive thing and not think every time or all the time about your situation, about cancer and what cancer took away with it. And
yeah, absolutely. I mean, that is actually valid for everyone, right? Be grateful for the small things in life. And then, I started doing that too. Writing in a diary 3 things I'm grateful for every day.
Yeah.
And it does change your perspective a lot, doesn't it?
Absolutely. And yes, I'm also grateful that I survived, grateful for living in a country where medical treatment is possible and available. And for, of course, also for my insurance for being so generous on allowing me a lot of treatments that other people maybe don't get. And yes, so
there's one question I have. I think it was you telling me about the guilt of a survivor.
Yes.
And that was the first time that I heard about that. And since then, I can't stop thinking about it. Would you like to tell us your perspective of that?
Yes. So when you go through this treatment, you get to know a lot of other people that are on the same path or even on a much harder path and way of healing from cancer. And maybe sometimes you also hear from other people not making it and dying on their way, on their treatment. So sometimes, of course, I'm really, really grateful for surviving cancer. And that's the feeling that I have like 99% of the time. But at some parts, when you get to know that other people didn't make it, or sometimes you have conversations with your friends or colleagues or so, and they tell you things like, well, you have to be grateful because you survived, and my son, daughter, mother, sister, whatever, didn't survive. And then you go like, well, there's nothing that I can do about it. I'm so sorry that I survived. And then your survivor's guilt comes totally unexpectedly.
Yeah.
And I had a similar conversation to a friend of mine a few months ago, and her daughter died of cancer. And I was complaining about my radiotherapy and about the consequences that I'm still facing and whatever. And she said, well, at least radiotherapy helped you surviving cancer. And at my daughter, it didn't work and she died. And I was like, yes, I'm so sorry for your daughter that she died. But yeah, that's
Yeah.
not my case. And there's nothing that I can do about it. But yes.
How do you handle those situations? How do you, I mean, of course, looking at the other side, I do understand their comments. And sometimes when you're in grief yourself, you're not empathetic against the other
Exactly.
ones, you know.
Exactly.
So I understand
Exactly.
both sides, but how do you in those situations react?
Yes, I also consider myself a very empathetic person. So I totally understand and I can totally relate to those feelings of why didn't my daughter survive or my whatever. Um, so after this conversation with my colleague, I had to cry. It made me really sad. And it made me feel selfish that I was complaining about the treatment that helped me surviving. And after that, I think, well, I cannot do anything about it. I cannot do anything about her daughter dying and me surviving, and that's life.
Yeah.
That's life. So as much as I can understand her feelings of my friend, and so I try that those feelings don't affect me.
Yeah. Yeah,
Yeah.
absolutely.
Mm.
I can imagine that this is a hard situation, right?
Yeah, it
Especially
is.
breast cancer. So many have breast cancer, and you will always meet people who did it, make it, and who didn't. And I can imagine this is a tough uh, moment or discussion.
Hmm. Absolutely. Yes. Mhm.
All right, I have one more question
Yes.
or one more topic we need to cover. For now, thank you for all the insights and for being so open with us.
Sure.
It's for everyone who works with medical communication, I think, an eye opener to really hear someone talking about their stories, right? And to actually everything we write down to see that this really affects people, you know. Um, a topic that I'm very much about. I mean, you all know about it. What made you choose to join the How to Speak Cancer family? That would be as a
Exactly.
survivor and medical communicator.
Yeah, exactly. I read about your book before MedTranslate in France, and I felt immediately related to it, to this project that at that time I think it was only a book, and I think at one moment you asked on LinkedIn if you want to collaborate with this project, send me an email or whatever. And I think I wrote down on a post-it, write an email to Catherine about your book, and then I forgot. And then we came to France all together, and I started speaking to you, and then all this How to Speak Cancer project got bigger and bigger and bigger, and I felt that um, through or by telling my own experience and by collaborating on this project, maybe I could help a lot of people see the other side and see that, as you said before, that real people are affected by cancer and
Yeah,
that cancer can affect everyone, every one of us. It's not only other people getting cancer or, I don't know, my friend's mother or whatever. It could also be you
yeah,
because it affected me. And as I said before, I had really um, no family history or so of breast cancer and no other signs or no other risk of getting breast cancer, and I got it. So it can really affect anyone. And
yeah,
I felt that it was um, a way of raising awareness on cancer and any type of cancer, and also giving a part of this empathy of like, I know what you're going through. I know how you feel. I know this is a hard way, but you will make it. You will get through it. And this
Yeah.
is why I was so happy when you asked me to be part of the project, what I'm really grateful for. And yeah.
Yeah, I was really happy to share your story in there, which is now also in the second edition of the English book published. And it's been in the German and the Swedish version from the beginning on, because it gives hope. And this is something I need people, or I think people need, doctors, or if you're in a clinical environment, it's rarely, you're rarely given hope, because they don't want to, make you hopeful, and then it doesn't turn out to be as they thought. So I understand that side too, as a former nurse. But for me, in my mission right now is to give hope, because I do see that the mindset is so very important to the whole treatment. And if you start hopeless into the treatment, then your chances are worse. They are, it's so, yeah, I was so grateful for you to joining in first with your story. And then you decided to become the German reviewer, and now even the Latin American reviewer, because Andrea actually has Latin American roots, right?
Exactly. I was born and raised in Argentina, and half of my family is from Argentina. So we spoke Spanish at home, and the other half, we're all from Germany. And so we also spoke German at home. So, yes, that's my background. Yeah, exactly. Mm-hmm.
Yeah, I'm really grateful for having you in all kinds of versions in my How to Speak Cancer family.
Thank you.
Well, then I covered all my topics for today. I would like to ask if anybody has comments or questions here. Karin just sent something.
Yes. Thank you, Karin, for your comments, and yeah, thank you for being here today. It means a lot to me too. Yeah.
Right. Just sending a big hug to Andrea.
Yes. Thank you very much. Yeah, and I would also like to add that I wish that I had your book when I started my treatment. I wish that I had all this information and all these kind and hopeful words when I started treatment. Yeah.
Thank you.
I think they would have helped a lot going through my treatment in a much easier way. And yeah.
Thank you. That is very kind. As you know, I was very hesitant to actually publish it at all, and I never thought somebody would approve it or like it. It's been a crazy journey, and I'm grateful for every single one who gets help, where the journey gets a bit easier by being better informed, right?
Yes, exactly. Yes. Again, thank you very, very much for all your kind words and for having me on this project, and yeah, being part of the team. Yes.
And thank you for being here again and really sharing those details with us. I know it's a hard ask to think about and go through this whole process again and again. So you did it once for my story, you did it now again here, and thank you very, very much, Andrea, for being here with us.
Very welcome. It's been a pleasure to be here today and sharing my experience and my insights with all these beautiful people that are here watching live, and also with the people that are going to watch it afterwards. So thank you very much for being here, for listening.
Jana just sent, and I want to translate that one because that is beautiful. She sends a big thank you.
I can say it myself if you would allow me.
Perfect. Yes, perfect.
Because I worked as a I would say practitioner.
Like
I was a gynecologist in this work a few years ago. And I met a lot of patients who had breast cancer myself. So it's a huge help to understand them better, because I mean, it's for me a hurdle to ask them deeper how they are, how they're feeling, because it mostly come back to us then after the cancer and get checkups, how they are and so on. So for me, it's still a big hurdle to ask them, how are they? Because I don't want to be insensitive. And and now I can understand them a little better, because like asking them sometimes it's really, I don't want to open any wounds. So yeah, that was a big help. Thank you.
Yes, thank you, Jana. Thank you for this insight. It's very, very important, and it's also very important for us patients to have a doctor who really listens and who really cares, and not just ask like, "How are you doing?" and write down notes and okay, patient complains about whatever, but really listening and open up for the patients and really listen to them. So thank you very much, Jana.
That's a
Thank you,
perfect ending note. Thank you, because this is what it's all about, communication and yeah, being a nice person. Right?
That's right. Yeah.
So I want to thank again, and I will stop recording now.